designed to make everything click. So if you're ready to crush the NCLEX, let's dive in. Okay, we will first talk about acid-base balance interpretation, one of the NCLEX's favorite topic, while a lot of people get stuck on this topic easily. But don't worry if this sounds tricky at first. I'm going to walk you through it step by step, from the basics to compensatory and uncompensatory states. We'll use some simple mnemonics, tricks, and tips to make it stick. Plus, I'll throw in examples, and then we'll cover causes, signs, symptoms, and management. By the end, you'll feel like a pro. Ready? Let's get started. First, let's talk about what acid-base balance even means. Your body likes to keep its pH between 7.35 and 7.45. That's the sweet spot. Too acidic, below 7.35, and you've got acidosis. Too basic, above 7.45, and it's alkalosis. Two main players control this: your lungs, which handle carbon dioxide, and your kidneys, which manage bicarbonate. Carbon dioxide is an acid, and bicarbonate is a base. Simple, right? Lungs blow off acid, kidneys hold on a base. Keep that in mind. It's the foundation. Now, how do we figure out what's going on in a patient? We use arterial blood gas results, or ABG for short. You'll look at three key numbers: pH value, partial pressure of carbon dioxide, and bicarbonate. Here's the step-by-step trick to interpret them. I call it the three-look method. Look at pH first, PiCO2, then bicarb. Let's break it down. Step 1, check the pH. Is it below 7.35? That's acidosis. Above 7.45? That's alkalosis. Between 735 and 745? It's normal, but hang on, there might be compensation hiding there. We will revisit the compensation part in the later part of this section. But first, let me give you an example. Let's say pH is 7.30. That's low, so we're dealing with acidosis. Easy so far. Step 2, look at PaCO2. Normal is 35 to 45 millimeters of mercury. If it's high, like 50, the lungs aren't blowing off enough carbon dioxide, so it's a respiratory problem. If it's low, like 30, the lungs are working overtime, and that's a clue for something else. In our example, let's say PaCO2 is 55. High means respiratory acidosis. The lungs are the issue here. Step 3, check bicarb. Normal is 22 to 26 milliequivalents per liter. If it's high, like 30, the kidneys are holding extra base. If it's low, like 18, they're losing it. If it is still tricky for you, here's a mnemonic to lock this in. Remember ROME, Rome, respiratory opposite, metabolic equal. For respiratory issues, pH and PaCO2 move in opposite directions. For metabolic issues, pH and bicarb move together in equal direction. Say it with me, ROME. It's your cheat code. Let's try an example. pH is 7.50, CO2 is 30, and bicarb is 24. Step 1, look at your pH. pH is higher than normal range 7.45, so it's alkalosis. Step 2, you look at CO2 level, and it is lower than normal range 35 to 45. pH is high and CO2 low, and you remember respiratory opposite from Rome. So it is respiratory alkalosis. So that means the lungs are blowing off too much carbon dioxide. Let's try another example. So pH is 7.20, which is low, so it is acidosis. Then CO2 is 38, which is normal. Bicarb is 18, which is low. So remember metabolic equal from Rome. pH is low and bicarb is low, which is the equal pattern. So it is metabolic acidosis. Now what about compensation? Simple analogy here. Think of ABG compensation like a team trying to fix a mistake. Fully compensated means the other system has completely fixed the problem, and this is when the pH is in the normal range 7.35 to 7.45. Uncompensated, on the other hand, means the other system is doing nothing to fix the problem. Partially compensated means the other system is trying, but the problem isn't fully fixed yet. So in here, if the lungs mess up, the kidneys step in, and vice versa. Let's try some examples. pH is 7.35, CO2 is 55, bicarb is 30, pH is normal, but it is in the lower side of the normal range as it is lower than 7.4, so it is normal but acidic. CO2 level of 55 is higher than 45, so pH is low and CO2 is high. They are opposite, respiratory opposite. Therefore, it is respiratory acidosis, but because pH is within the normal range, it is fully compensated. Normal pH but abnormal CO2, and bicarb means compensations at play. But if the pH is abnormal and one of the other two CO2 and bicarb values are abnormal, causing the problem, then it is uncompensated. The other value is normal, which means it hasn't tried to fix it yet. It's like the lungs or kidneys haven't stepped in to help yet. It's like a fire starting, but no one has called the firefighters yet. And if pH is abnormal, meaning the problem is not fully fixed, and both CO2 and bicarb are abnormal, meaning the other system is trying to fix it but hasn't fully corrected it yet. It's like firefighters showing up to a fire, but the fire is still burning. And it's when all of these three values are abnormal, and this is called partially compensated. Let's practice one more example. pH 7.25, CO2 40, bicarb 18. pH is low, so it is acidosis, and it is abnormal as it is less than 7.35, so it is not fully compensated. Next, CO2 is normal, so the lungs are fine. Then bicarb is low, so the kidneys lost base, and so metabolic equal, which means it is a metabolic acidosis. But because CO2 is normal, it is uncompensated metabolic acidosis. All right, now let's shift gears. What causes these imbalances? Respiratory acidosis comes from anything slowing breathing, aka underventilating. Think COPD, pneumonia, or drug overdoses like opioids. Respiratory alkalosis is hyperventilation, like panic attacks, pain, or high altitude. What about metabolic acidosis? It's anything non-respiratory related except vomiting. So like kidney failure, diarrhea, or diabetic ketoacidosis, DKA for short. Metabolic alkalosis is basically vomiting, meaning too many antacids. NCLEX tips and tricks here. If you are not sure what it is and it is not respiratory, then choose metabolic acidosis. Higher chance to get it right. Signs and symptoms depend on the problem. Remember this key concept: as the pH goes, so does my patient. So as pH goes up, your patient goes hyper, while as pH goes down, so does your patient except potassium. So for any acidosis, whether respiratory or metabolic, your pH is going down, which means your patient goes down too, leading to their heart rate go down, blood pressure go down, lethargic, and constipated. But for potassium, it is opposite, so you experience hyperkalemia. What about alkalosis? Alkalosis means your pH goes high, meaning your body goes high too, which means you experience symptoms like tachycardia, tachypnea, hypotension, and seizure except potassium, which goes opposite, so hypokalemia. Management is where it gets practical. For respiratory acidosis, fix the breathing. They are underventilating, so oxygen and ventilators if needed. If patient is experiencing respiratory alkalosis, they are hyperventilating, so slow the breathing. Paper bag trick for panic attacks works sometimes. How about metabolic acidosis? You got to treat the cause, give insulin for DKA and fluids for diarrhea. What about metabolic alkalosis? They are losing fluids from vomiting, so replace fluids and electrolytes, so give IV saline. Always treat the root problem, not just the numbers. And let's shift the gear into electrolyte imbalances. NCLEX loves to ask you about these questions because those sneaky little shifts can throw a patient off balance. We'll cover the signs, symptoms, and how to manage them, plus some NCLEX hacks to make this stick. I'll throw in a couple of practice questions too, so you can test your skills. Let's dive in and make this as painless as possible. First off, electrolytes are like the body's electricians. Potassium, calcium, magnesium, sodium. They keep things running smoothly. When they're out of whack, you'll see patterns in the symptoms and management. Here's the deal. The earliest sign of any electrolyte imbalance is numbness and tingling, also called paresthesia. Picture your patient saying their fingers or lips feel buzzy. That's your red flag. Another big one? Muscle weakness or paresis. It shows up with all imbalances, so keep an eye out. With that being said, let's break it down by electrolyte, starting with potassium, our kalemias. Normal potassium is 3.5 to 5. Too high is hyperkalemia, too low is hypokalemia. Here's a trick for NCLEX. Potassium follows the prefix, except for heart rate and urine output. So hyperkalemia means high energy like muscle cramps, restlessness, but low heart rate and low urine output. Hypokalemia is the opposite, so everything is low like lethargy, weak muscles, except heart rate and urine output, so high heart rate and more urine output. Memorize that exception. This is NCLEX's favorite. Next up, calcium, our calcemias. Normal is 8.5 to 10.5. Here's the tip. Calcium does the opposite of the prefix. Hypocalcemia, low calcium, means overexcited nerves and muscles. Think twitching, cramps, even spasms in the throat. Hypercalcemia, high calcium, slows things down. Lethargy, weak reflexes, constipation. Opposite of the prefix, lock that in. Magnesium follows the same rule, opposite of the prefix. Normal is 1.5 to 2.5. Hypomagnesemia revs things up. Tremors, seizures, fast reflexes. Hypermagnesemia calms it down. Drowsiness, slow breathing, weak muscles. Same as calcium, just flipped from what you guess. Sodium's a little different. It ties to fluid status. Normal is 135 to 145. Hyponatremia, which is low sodium, means fluid volume overload. Think swollen, confused patients, maybe seizures if it's bad. Hypernatremia, which is high sodium, means dehydration or fluid volume deficit. They're thirsty, dry, and irritable. Sodium's all about water balance. Now let's prioritize. Hyperkalemia is your top concern as it can stop the heart cold with those peak T waves on the ECG. Assess early, so like early signs like paresthesia or muscle weakness are your clues something's up. You have to intervene smart, like fix the imbalance, but watch for complications. Potassium messes with the heart. This is #1 electrolyte imbalances you have to prioritize. Okay, what about management? It depends on the type of imbalance. For hypokalemia, obviously you should give potassium chloride PO or IV, but make sure you are giving it slow if given through IV. Also, don't forget to monitor the heart first. Hyperkalemia, too much K? Give Kayexalate, K exit. Late will remove potassium from the system. Also, you can give insulin with glucose and maybe calcium gluconate to protect the heart. What about hypocalcemia? It definitely needs calcium. Give it through IV if it's urgent. Oral if it's mild. Hypercalcemia? Flush it out with fluids and diuretics. Magnesium's similar to calcium treatment. Replace it for low, dilute it for high. What about sodium? For hyponatremia, you should restrict fluids or give hypertonic saline if severe. Hypernatremia needs slow rehydration to dilute the fluid. All right, let's try an NCLEX-style question. A client with heart failure is on furosemide Lasix, and the nurse sees muscle weakness, irregular heartbeats, and a potassium of 2.8. What's the first action? Options: A, encourage potassium-rich foods. B, give potassium chloride as prescribed. C, place the client on a cardiac monitor. D, hold the next dose of Lasix. Pause and think. What's your pick? The answer is C, place the client on a cardiac monitor. Here's why. 2.8 is dangerously low. Hypokalemia can trigger deadly arrhythmias. Monitoring the heart is priority 1 for safety before you replace potassium. Foods won't fix it fast enough, and giving potassium comes after you've assessed the risk. Smart move, right? One more. A nurse assesses a client with hypocalcemia. Which finding needs action now? A, positive Trousseau's sign. B, numbness and tingling around the mouth. C, new onset of laryngeal stridor. D, muscle cramps in the legs. What's your gut say? It's C, laryngeal stridor. Low calcium overexcites nerves and muscles, and stridor means the airway spasming. That's life-threatening. Trousseau's and tingling are classic signs, but not urgent. Stridor? You act fast to keep them breathing. So here's your takeaway. Memorize the patterns. Potassium follows the prefix except heart rate and urine output, calcium and magnesium